Hello everyone. I am Sabrina. I am a student physical therapist from the University of Michigan Flint, and I am doing my clinical internship here at Renew's Freeland location with Casey, the physical therapist here. And today I'm going to talk about severe and frequent headaches and how to find relief. So first of all, what's the problem? 1 in 6 people suffer from migraines or severe headaches, and it is the 5th leading cause for emergency department visits with over 4 million visits a year. And those who do have severe headaches or migraines typically have a lower perceived quality of life, and they're also more likely to have interrupted sleep and depression, anxiety, and panic disorders. So this is a list of people who are most at risk for severe headaches. And it includes people who are 18 to 44 years of age, with those 45 to 64-year-old age group having the second highest prevalence. Women are 2 to 3 times more likely than men to have them, as well as those who are mixed race, American Indian, or Alaska Natives. Also, if you're unemployed, poor or near poor, have a lack of insurance coverage, if you have a high school education or less, or if you have sleep disorders, including insomnia, narcolepsy, and sleep apnea. So a lot of you may be wondering where headaches come from. Headaches are described as a sensation of pain or discomfort in the head or face, and they don't actually come from the brain. The brain does not have any nerves inside with pain receptors. It comes from nerves that exit the brain and go into the face and the head and the neck. So that can include the trigeminal nerve, the vagus nerve, and the occipital nerve, among others. And this picture I have on the right is the trigeminal nerve coming out of the brain, and its 3 branches go into the face, just so you can get an idea. So what happens is that these nerves send signals to the thalamus in the brain, where it's interpreted as pain, and then the brain responds in a bunch of different ways, which can lead to other symptoms, which include nausea and vomiting, diarrhea, difficulty focusing, and other neurological symptoms, which would mean weakness, dizziness, loss of balance, difficulties with speech, or seizures. And next we have 4 different types of headaches that we are going to be talking about today. That includes a cluster headache, which you feel in or around one eye. You have a tension headache. It feels like a tight band is squeezing around the temples or your forehead. There's migraines, which you have pain where you feel on one side, accompanied by nausea and visual changes. And you also have cervicogenic headaches that are referred from the neck if you have neck issues, and pain is felt at the top or the back of the head. So first we'll be talking about migraines. They're the second most common type of headache, and it's a type of headache with recurrent attacks and usually felt on one side of the head. It comes from nerves and the blood vessels surrounding the brain in a place called the meninges, which protects the brain and spinal cord. And triggers include lack of sleep, changes in weather, stress and anxiety, overexertion from exercising, as well as caffeine, bright lights, and certain medications. It can occur with or without an aura, and it has 4 phases, which I have on the right with some symptoms. The first phase is prodrome. So it occurs hours to days prior to your headache symptoms, and it's accompanied by fatigue and nausea, mood changes, appetite changes, difficulty sleeping or focusing, and sensitivity to bright lights or sounds. And then you have your aura phase, which is the second phase. And again, some people have it and some people don't. It occurs 5 to 60 minutes prior to your headache symptoms. You can have visual disturbances, loss of vision, numbness and tingling, as well as dizziness, speech changes, and brainstem aura. And then you have your headache phase, which can last anywhere from 4 to 72 hours. You can have moderate to severe symptoms with it, and it's accompanied by throbbing, light or sound sensitivity, nausea and vomiting, and symptoms that are made worse with movement. And the final phase is postdrome, which is 24 to 48 hours following your headache. And people typically feel mood changes, difficulty focusing or concentrating, tiredness, brain fog, maybe a residual headache. And treatment for migraines is often done using medications prescribed by your doctor. They can include analgesics, NSAIDs, antidepressants, triptan, barbiturates, and ergo derivatives. And sometimes what happens when you take these drugs for headache relief more than 3 times a week, you can get medication overuse headaches. And that's experienced when you have initial headache symptoms and they're relieved after you take some of those meds, and then they start to come back as the medication wears off. So if you think that you have some symptoms for medication overuse, you should talk to your doctor. There's also some quick solutions that you can try to ease your symptoms at home. That includes napping or resting more often. You can try placing a cool cloth on the forehead, staying hydrated and drinking lots of water, especially if you're vomiting. And small amounts of caffeine in the early stages might help as well. There's also some natural remedies that people try for migraine symptoms, and that includes vitamin B2, magnesium, coenzyme Q10, and butterbur, which is a type of plant. There's also some non-drug therapies that are used, including biofeedback and relaxation training. And then your doctor also might recommend some lifestyle changes, including getting some more exercise, having a healthy diet, and getting more sleep. So next we have cluster headaches. As you can see from the picture on the right, it is not pleasant. It's actually a depiction of somebody describing what it feels like to have a cluster headache. They're known as the most severe type of primary headache and often described as the devil trying to rip out their eye. So not fun. With cluster headaches, pain reaches its peak about 5 to 10 minutes after onset and can continue for up to 3 hours. So before you start feeling those symptoms, you might get migraine-like auras and nausea as well. And additional symptoms include redness, tearing, and swelling on your affected side, as well as restlessness and agitation, and increased heart rate and blood pressure, and increased sensitivity to light, sound, and smell. They often occur at the same time of day or night for several weeks in a row, which is why they're called clusters. And it's not known exactly how or why they happen, but possible causes could include alcohol and smoking or genetics. And this type of headache is known for interrupting sleep very often, since if it starts happening during the night, it'll keep happening around the same time of night. So next, these are some treatments for cluster headaches that your doctor might try with you. Again, I would consult them for looking into this. So the first one is non-invasive vagus nerve stimulation. And with that, I actually have a picture on the right to kind of show what happens. You hold a device up to your neck where the vagus nerve is, and it sends electrical impulses to the vagus nerve, trying to dampen those pain signals that are sent into the brain. And it's used while experiencing or you're about to experience cluster headache symptoms. There's also injections that are used for the prevention of migraines and cluster headaches. And then medications for them include antipsychotics, anticonvulsants, and calcium channel blockers. There's also oxygen therapy, where pure oxygen is inhaled through a mask, and that reduces the blood flow to the brain. And in extreme cases, electrical stimulation of the occipital nerve in the eye or surgical interventions are considered. And then we have tension headaches, which are the most common type of headache. And it's described as a tight band that's being pulled around the forehead or temples. It can be caused by stress or strong emotions, which leads to contractions of muscles in the face, head, and neck. Other causes include clenching the jaw, having missed meals, lack of sleep, and depression or anxiety, as well as poor posture, arthritis, or dysfunction of the temporomandibular joint in your jaw. So these headaches can be episodic, which means they're less than 15 days a month and less than 30 minutes in duration, or they can be chronic, which would be greater than 15 days a month and constant symptoms. And here I have some pictures of the muscles of the front of the neck, just to get an idea. So on the left, we have the more superficial muscles, including the platysma. And then you have the SCM, which stands for sternocleidomastoid, and your scalenes in the front of your neck. You also have your deep neck flexors, which is on the right picture, and those are right in front of your cervical spine. And those are often weak in people with poor posture. And then we have the muscles in the back of the neck. So on the left again is the more superficial muscles, that being the trapezius, which is that triangular shaped muscle. And then you have your splenius muscles and your rhomboids, which connect your shoulder blade to your spine. And then the picture on the right has the deep muscles in the back of your neck. And that includes the multifidi, which are responsible for stabilization of the spine and your neck. You have your suboccipital muscles, the rectus capitis posterior and oblique capitis superior in there, and that connects the back of your head to the top of your neck. And then you also have your levator scapulae, which connects the top of your shoulder blade to your neck as well. And then I have a picture showing what those muscles look like when you kind of got that forward head, slumped posture. So with that, you have your muscles in the front, which is your pecs. Those are tight, as well as the muscles in the back of the head, the suboccipitals, the upper traps, and your levator scaps. And then you have muscles that are tight, that are pulled taut and weak, which would be your muscles in the front of your neck, the deep neck flexors, your SCM, and your anterior scalenes, and in the lower back, which would be rhomboids and lower traps. And here are some treatments that are used for tension headaches. A lot of the times they want to find the root cause first. For example, if you have sleep apnea, they'll do a sleep study for you, or if you have arthritis that's causing your symptoms, you might be prescribed anti-inflammatory medications. And then other medications that are used are similar to those that are also used for migraines, which I mentioned earlier. And then we have alternative therapies, which includes biofeedback and relaxation training, as well as meditation and cognitive behavioral therapy for stress. Something else that will help is trying to take a hot shower or putting moist heat on the back of your neck to get some muscle relaxation. And physical therapy as well can help with tension headaches. And then we have cervicogenic headaches, which are very often underdiagnosed. And that's described as having pain on one side of the head that starts in the neck, and it will come around to the top or the front. And pain usually starts after moving the neck with this kind of headache. And that's usually because it's caused by restrictions in the upper cervical spine in your neck. And it's most common in people who are 30 to 44 years of age. And this is a picture of the cervical spine just to give you an idea of what's going on. So we have each spinal segment in there is called a vertebrae, and it's labeled C for cervical in the neck. C1 and C2 are the first two vertebrae at the top, and that's called the upper cervical spine. And C3 through C7 in the purple is the lower cervical spine. So those upper cervical vertebrae at the top are where you get your dysfunction maybe between those and get your cervicogenic headache symptoms. And these are pictures kind of showing how that happens as well. The picture on the left shows how there's a lot of nerves that surround and come out of the spinal cord. So if you have some dysfunction or mobility problems in your first like C2, C3, C1 area, those nerves can get pinched or irritated, and that sends pain signals into your head and your face. And this picture on the right shows some of those referral patterns. So if you have issues between the bottom of your skull and your first cervical vertebrae, you would have pain in that yellow area in the back of your head. If you have issues between C1 and C2, you would have it in that red area behind your eye. And if you have issues between C2 and C3, you would have pain in the blue area above your eye. So next we have just showing how that upper cervical spine moves along with the head. So the skull on the bottom is called the occiput, and that will sit on C1, which is called the atlas. And what that does is it primarily allows for flexion and extension of the head. It's called the atlanto-occipital joint. And then we have C1, the atlas, sitting on top of C2, which is the axis, called the atlanto-axial joint. And as you can see, the axis has this bony projection that goes up into the atlas called the dens, and that's responsible for 50% of all rotation of the neck. And the upper cervical spine is responsible for most of the movement of the head and neck, actually, which is why it's less stable than the lower cervical spine. So treatment for cervicogenic headaches does include physical therapy with the use of manipulations, exercise, and postural training. There's also different interventional therapies depending on what the root cause is. For example, you can do injections for arthritis or whiplash injuries, nerve blocks for temporary relief, as well as radio frequency ablation for long-term relief. And then you can have epidural steroid injections before considering surgery. Surgery is really considered as the last resort for intervention in cervicogenic headaches. And this is a list of all the other different kinds of headaches that people can have that we're not really going to go into today. But first being primary headaches, those are called primary headaches because they're not really caused by any other conditions. And then we have the secondary headaches, which usually you get symptoms of headache because it comes from something else that you might have, a disease or disorder. So that can include brain tumors, stroke, substance exposure or withdrawal, head injury, increased head pressure, inflammation from injections, seizures, spinal fluid leak, structural abnormalities of the head, neck, and spine, or trigeminal neuralgia. And these are some red flag symptoms. What that means is if you are experiencing any of these symptoms with your headaches, it means that you might be getting them from something else that's going on, and it's important that you talk to your doctor. So these include a fever or other systemic symptoms like whole body aches or increase in heart rate or blood pressure. If you have a history of tumors or cancer, if you have neurological signs, which include difficulty walking, dizziness, double vision, difficulty speaking, arm or leg weakness, and seizures. If you have a sudden onset of headache, if you are older than 50, if you have a worsening or changing of symptoms without a known cause, if you have a positional headache, like if you're lying down and you sit up and your headache comes on, if you have a headache following sneezing, coughing, or exercise, if you have a change in your symptom patterns, if you're pregnant or up to 6 weeks after childbirth, if you have pain in the eye with vision changes, a headache following a traumatic injury, the onset of headache after taking painkillers or a new drug, which I talked about earlier, or if you have an autoimmune disease or disorder. So you're probably wondering what physical therapy can do to help with headaches. Well, it's been shown to be effective in treating tension type headaches and cervicogenic headaches using therapeutic massage, spinal manipulations, postural training, and therapeutic exercise. There's also some conflicting evidence for treatment of migraines using physical therapy, but the general consensus is that controlled and moderate intensity aerobic exercise could be beneficial for prevention of migraine symptoms, but too much of that may actually make your symptoms worse. Why it's important if you have migraines to talk to your doctor before changing your exercise regimen. And here are some pictures of something that we do called cervical traction. What it does is it takes pressure off of structures in the neck. That includes the muscles, those vertebrae segments, the discs between each of your vertebrae, and blood vessels and nerves. It can create more disc space, and it can also kind of lengthen those muscles that might be tight in there. So on the left, we have manual therapy done by the therapist, which is done between 5 and 10 minutes in duration. And then we have a mechanical traction device for the neck on the right, which is done for a duration of 15 to 30 minutes. We also do spinal mobilizations and manipulations. Mobilizations are kind of slow movements done over a larger area that encourage mobility in the neck. So as you can see, as that in that picture on the left, the therapist is placing their hands underneath the patient's neck, feeling for those individual spinal segments and encouraging them to move. We also do manipulations, which are those short and quick movements to encourage alignment and mobility that you might associate with chiropractors. And then we also use muscle energy techniques, which is the use of manual contractions of the muscles when putting you in a position of limitation to encourage alignment. So next, I'm going to show you a technique that you can do at home. You'll need a towel, but it's called a headache snag. And this is most effective for cervicogenic headaches, which means when you have symptoms that are triggered by movement in the neck. So what you're going to do is you're going to place your towel right around the back of your neck like this. And where you want to put it is you want to find C2, and you find that by feeling for the bottom of your skull coming down, and it's that first bump you feel. So you want to put it right there. You're going to pull it straight forward, and you're going to pull gently straight forward like this. Hold for about 10 seconds, and then you relax. You would do that between 6 to 10 times. When you do this, it's to encourage those vertebrae in the top of your neck to move when they're not really moving. And you should not be getting any pain from it or any increase in pain. So if you are, you should stop immediately. Next, we have rotational snags. You would do this if you notice that you have pain or limitations turning your head one way or the other. And how you would do this is, again, you put that towel behind your neck at that level of C2. So again, you find that first bump. You're going to take your opposite hands of the way you want to turn. You're going to pull it down towards your chest. And you're going to take your hand from the same side, reach across, grab the towel, pull it across your face. And you're going to slowly help rotate your head until you feel your limit. Hold for about 10 seconds. And then you relax. Again, this is best used for cervicogenic headaches, where you get pain when you move your neck. So if you are feeling an increase in pain with this, you should not do them. And then we also do postural training and therapy. So a lot of the times people are standing or sitting, they kind of slump forward, with the forward head and rounded shoulders. We want to encourage sitting up nice and tall with the chest out. Also with bending or lifting, a lot of people slump forward to grab. What you want to do is keep your back straight and use your legs. And then also if you're using the wrong kind of pillow, if it's too flat or too fluffy, it can leave your neck in a bent posture when you're sleeping, and that's not good. So you want to find a pillow that supports it in the neutral position best you can. So what we've got on the right are a couple of exercises to help strengthen those muscles and your neck and shoulders, promote better posture. So the first one we're going to do are chin tucks, and this strengthens those deep neck flexors in the front of your neck. So what you're going to do is you're going to make a double chin, just like this. You're not going to be tipping your head forward or backwards, just like this. And push, make that double chin. And hold for at least 5 seconds. And then relax. And you perform that 10 times when you do them. And we also have something called scap retractions, which are actually shoulder squeezes. And what you're going to do for these is you're going to keep your arms down by your sides. And you're going to pinch them together like it's shown in the picture. Fast you can, like you're trying to squeeze a dollar bill. Hold for at least 5 seconds. And relax. Again, you would perform that 10 times when you do them. And next we have some stretches for the muscles in your neck that can help relieve some tension and maintain good posture for you. So the first one in the top left corner is a stretch for your upper trap, which is right here. So what you're going to do is you're going to bend your head to the opposite side. And And then you're going to rotate to the same side, looking up towards the ceiling. And you should feel a stretch right here. If you don't, you can take that arm on the same side, grab the bottom of your chair, or provide just gentle pressure with your opposite hand on the side of your head. And then we also have on the bottom left corner, levator scap stretch, which is that muscle at the top of the shoulder blade connecting up to the neck. So what we're going to do for that one is we're going to bend the head forward as far as you're comfortable with, and then you're going to lean and rotate your head to the opposite side like you're trying to smell your armpit. And if you're not getting a stretch with that, you can also take the arm on the same side, reach behind your back, or provide some gentle pressure on the back of your head with your other hand. We also have a stretch for your scalenes in the front of your neck. So what you do for these is you're going to lean your head back. You're going to tilt your head to the opposite side and look up at the ceiling. And you should feel these muscles right here grow taut and feel a stretch right where those scalenes are. And then we also have on the very right a picture for a suboccipital stretch. Those, again, are the muscles that connect the bottom of your skull to the top of your neck. So what you're going to do for these is you're going to make that double chin like with the chin tucks. You're going to take your other hand, place it on the back of your head, and you're going to pull up and forward. And you should feel a stretch right at the top of your neck. So with all of these stretches, you should hold them for at least 30 seconds at a time for 3 sets. So how can physical therapy help you? A physical therapist can evaluate each type of headache, some possible causes, and your appropriateness for therapy, as well as come up with a plan of care. We can assess progress throughout your treatments. We do therapeutic massage to help promote muscle relaxation, as well as manual therapy techniques that I mentioned earlier for mobilization and alignment of your spine. We also do postural training and exercises to strengthen the muscles of the head and neck, like some of what I just showed you. And we discuss activity modifications and lifestyle changes as they're appropriate for each person. And just if you're wondering if physical therapy is right for you, if you're not sure or not, Renew does offer free 15-minute screenings at all locations. And we also have a headache tracker sheet that you can use where you can put down your symptoms, when they happen, and possible triggers that you might think are causing them. And this can help your healthcare providers figure out what's going on and help you resolve your headaches. So that is something that we can include in an email or provide a physical copy if you come to one of our locations. These are my references for this presentation, and these are the 16 locations that Renew Physical Therapy has. So, any questions at this time?
Thank you, Sabrina. This is a lot of great information. I didn't see any questions come through, but I do want to remind everyone who registered that you will receive a follow-up email that will allow you to access the recording of this presentation. It'll have some of our top takeaways in it, and then we'll also link to a printable version of that headache tracker. So I think we're all set, but thank you to everyone who joined us, and thank you to Sabrina for presenting today.
Thank you.